Do you know which cancer tests everyone should get? I'll tell you right away. It's not a blood test. Neither tumor markers nor a complete blood count can detect cancer at an early stage, and yet these are exactly what patients ask for most often. The result? Money wasted, a false sense of security, time lost, and the disease keeps going nowhere. Most people are afraid of cancer and want to protect themselves, but they have absolutely no idea which tests actually work. Today, I'm giving you a concrete plan by age group from 20 to 60 and beyond. Only the most essential screenings, no fluff. Let's go. But first, the biggest misconception. Tumor markers and complete blood counts do not detect cancer at an early stage. They don't, at all. And yet, these are the tests people request most. They get the results, everything looks normal, and they relax. Meanwhile, the disease quietly keeps developing. This isn't just a waste of money. It's a false sense of security that delays real diagnostics. Remember this. Now, let's move on. At what age should you actually start worrying about cancer? Statistics say at 20, the probability of getting cancer is vanishingly small, but that doesn't mean you can do nothing at all. The list of screenings at this age is short, but important. Step 1, understand your family history. About 10% of all cancers are hereditary. 1 in 10 patients inherited the disease from a relative. How do you know if you're at risk? If someone in your family was diagnosed with cancer before 45, if several relatives had the same type of cancer, or if rare tumors appeared in the family, that's a signal. In that case, it's worth discussing genetic testing with your doctor. Why? It helps you understand which screenings you need earlier or more frequently. For example, with Lynch syndrome, a hereditary condition that dramatically increases the risk of colorectal cancer, screening should start as early as age 20 to 25, not 40, 20 to 25. Step 2. Identify infections that increase cancer risk. Yes, infections. It sounds unexpected, but it's a fact. HIV, hepatitis B, which increases the risk of liver cancer and lymphomas, and human papillomavirus, HPV. It's linked to 5 types of cancer. The virus is sexually transmitted, causes no discomfort, no pain, no symptoms, and so a person can carry it for years without knowing. There are more than 200 known types of HPV. 14 are oncogenic. The most dangerous are type 16 and 18. They're responsible for 70% of cervical cancer cases. The virus is sexually transmitted, shows no symptoms, doesn't hurt, and people live with it unaware and unknowingly pass it on. For women starting at age 21, get an HPV test. Every 3 years, add a pap smear. This is the primary screening against cervical cancer. For men, the test is generally not informative and is not necessary. And get the HPV vaccine if you haven't already. 99% of cervical cancer cases are linked to this virus. This is the only type of cancer you can vaccinate against before it ever develops. That's not a metaphor, it's literally cancer prevention. Complete blood count. Yes, I just said it doesn't detect most cancers, and that's true. But at a young age, it's useful for a different reason. It can indicate changes characteristic of leukemia. This disease occurs most often in young people, and here the blood test provides an important clue. For women, breast ultrasound once a year. Formal guidelines say you can do it less frequently at a young age, but the reality is tumors in women in their 20s and 30s are found, and often they're found by accident during completely unrelated procedures because those women had never gone for a routine ultrasound. They thought it was too early. It's not too early. Once a year, that's 30 minutes of your time. So at 20, don't panic, but do get screened and vaccinated. It's an investment in a healthy future. From age 30. 30 is not still young. The body starts responding differently, and our goal now is not just routine checkups, but actively looking for the first silent changes. What the body forgave at 20, it won't forgive at 30. Skin and moles. Once a year, see a dermatologist and get dermoscopy if needed. Yes, we no longer spend hours baking in the sun like previous generations did, but moles, old scars, and unusual spots still need a doctor's eye. Old scars are a separate risk factor for squamous cell skin cancer. Don't ignore them. For women, continue breast ultrasound once a year, especially with a family history. Under 40, breast tissue is dense, and ultrasound is the best tool for distinguishing benign changes from malignant ones. Nursing mothers, pregnant women, stick to the schedule, no exceptions. Continue the pap smear and HPV test. Add a gynecological ultrasound, uterus and ovaries. For men, abdominal ultrasound, liver, kidneys, pancreas. For everyone, a biochemical blood panel, liver enzymes, creatinine, iron, vitamin D, not an oncology screening, but a clear picture of how your body is working right now. Do you smoke? First, quit. Second, low-dose CT scan of the lungs. A chest x-ray won't give you the picture you need at early stages. From age 40. 40 is a real turning point. This is when it first becomes possible to catch not cancer itself, but what will become cancer, precancerous changes, when intervention is still minimal and results are maximal. This is exactly what screening exists for. For women, mammogram once a year. People often ask why a mammogram if there's ultrasound. Here's the answer. Under 40, breast tissue is dense with lots of glandular tissue. Ultrasound works great. After 40, glandular tissue gradually gives way to fatty tissue, and changes show up much better on a mammogram. Ultrasound becomes a supplementary method. Mammography becomes the primary screening. Stomach. From this age, gastroscopy, especially if you have chronic gastritis, symptoms, or a family history of stomach cancer. Stomach cancer is in the top 5 most common cancers, and it's treated very poorly at late stages. A word on H. pylori. Many people have heard the name, few understand how serious it really is. This bacterium lives in the stomach lining. The International Agency for Research on Cancer classifies it as a Group 1 carcinogen, meaning proven. It increases the risk of gastric adenocarcinoma by 4 to 6 times. It's also linked to the development of multilymphoma, a lymphoma of the mucous membrane. How to check? A urea breath test, accurate, non-invasive, detects active infection, or a biopsy during gastroscopy. That's the gold standard. If you're getting a gastroscopy, ask your doctor to take an H. pylori sample at the same time.
Colon. By 40, the risks of colorectal cancer start rising. Add a colonoscopy or at least a fecal occult blood test, once every 5 years with no risk factors. For men, PSA, prostate-specific antigen. Not for everyone, but based on indications, especially if there's a family history of prostate cancer. And continue everything from before. Gynecologist for women, dermatologist for everyone. This is the foundation that never goes away. From age 50. 50 is an important milestone. If before we were talking about prevention and targeted checkups, now the risks start rising sharply. If you're 50 and never gone through screening, set aside 2 days and do it. This is an investment that can genuinely extend your life. At 50, we move into comprehensive screening of the so-called Big Four: breast, colon, lungs, prostate. Women, mammogram annually. Not every 2 years, not when I remember. Only consistent annual screening allows you to catch a tumor at stage 1. Colon, colonoscopy. At 50, this is no longer optional. It's the gold standard. Minimum once every 10 years with normal results. A fecal occult blood test is a less informative but acceptable alternative. Lungs, low-dose CT. Lung cancer kills more people than any other, and most people lose time thinking a chest x-ray is enough. It isn't. It shows nothing at early stages. Low-dose computed tomography reduces lung cancer mortality by approximately 20%, especially critical for smokers with more than 30 years of smoking history. An interesting fact, during the COVID pandemic, lung cancer was diagnosed significantly more often, not because the virus causes cancer, simply because people were getting CT scans en masse, and early tumors were found on those scans that no one had suspected. People felt nothing, the cancer was already there. That's the strongest argument for CT screening. For men, PSA becomes a regular test, the basic marker for early detection of prostate cancer. For everyone, complete and biochemical blood count, not to detect cancer directly, but as background monitoring. It helps a doctor notice what might otherwise go undetected. At 50, diagnostics stop being just in case and become an essential minimum. From age 60 and beyond. One principle: don't stop. Risks keep rising. That's exactly why you can't decide, I'm already older, why bother? Everything listed above remains relevant. Regularity is now your most important tool. And finally, what we haven't talked about. Screening doesn't cover every type of cancer. We're targeting the most common and most dangerous ones. Everything else is caught through symptoms, so it's important to know the warning signs and not ignore changes in how you feel. And once more, tumor markers and complete blood counts are not part of any international screening guidelines for healthy people. They're useful for monitoring already treated patients. For a healthy person, they're a waste of time and money. This isn't an opinion, it's medical consensus. Now you have a clear plan from age 20 to 60 and beyond. Save this video, share it with the people you care about, because a screening done on time isn't paranoia. It's the only way to catch cancer when it can still be beaten. Subscribe and hit the bell so you don't miss the next one. Thank you for watching, and here's to your good health. Goodbye.